Rectal prolapse. Rectal prolapse is a condition wherein the rectum, which is the last part of the large intestine, slips out of the anal opening and protrudes out of the anal canal. And in severe cases, it remains out of the anal canal. This can be compared to how the shirt can protrude out of the coat sleeve. And when this happens, the rectum is prone to injury, it can bleed, and it can cause extreme discomfort to the patient. So why does rectal prolapse happen? What are the treatment options for it? Due to various reasons, the rectum, which is a muscular tube of the large intestine, is usually kept well supported inside the pelvic cavity. When these supports become loose, or because of constant repeated straining in the motion due to constipation, the rectum is subjected to continuous outward pressure, and that causes the rectum to protrude out of the anal canal and hang out like a tube. This is usually seen in old people, but we also encounter this condition in many young people. In this condition, in the early stages, whenever the patient passes motion, the rectum comes out of the anal canal, and after that, it can either spontaneously go back inside, or the patient can push it back with his fingers. As time progresses and as the disease gets severe, the rectum comes out and refuses to go back inside, and this becomes a major problem. How do we treat rectal prolapse? To prevent rectal prolapse, one has to avoid constipation, and that is achieved through high fiber diet, adequate fluid intake, and avoiding straining in the motion. But once rectal prolapse has happened, medical therapies are not very effective in putting the rectum back into position, and that is when a surgical treatment is required. Traditional treatment methods included an open operation which involved a long cut on the abdomen, and through that the rectum is pulled back inside and fixed in place. Nowadays, just like most other gastrointestinal problems, we offer a laparoscopic repair for this condition, wherein with the help of 3 or 4 keyholes, the rectum, which is protruding out of the anus, is again pulled back, fixed into position to the sacral bone, and this fixation is reinforced by use of a mesh. And once this surgery is done, the patient can continue to have a normal life without the rectum prolapsing every time outside when he goes for motions.